Greetings from Suraj Eye Institute. Suraj Eye Sciences Academy is pleased to present the Spark case-wise. We present to you a case of peripapillary edema from hemicentral vein occlusion, a red herring in the evaluation of the retinal nerve fiber layer. The retinal nerve fiber layer assessment is a key factor for management of glaucoma. Presence of coexisting ocular disease has an impact on the RNFL and precludes its accurate assessment. It was the purpose to highlight the nuance of the RNFL analysis with other ocular findings. A male, 65 years of age, came with the chief complaints of sudden, non-progressive and painless diminution of vision in left eye since one day. He was a known case of systemic hypertension and ischemic heart disease. He was a known case of primary open-angle glaucoma and was under treatment for the past 20 years and had undergone trabeculectomy with cataract extraction with intraocular lens implantation in left eye in November 2012 and in right eye in January 2018. On clinical examination, his best corrected visual acuity was 6.6 N6 in right eye and counting finger 3 meters N36 in left eye. Slit lamp biomicroscopy showed functional bleb, patent surgical peripheral iridectomy, and intraocular lens in both eyes. Intraocular pressure recorded by Goldman applanation tonometer was 16 mm mercury in both eyes. Fundus examination of right eye showed a vertical cup to disc ratio of 0.9:1 and pale neuroretinal rim. Left eye showed glaucomatous disc, edema, and hemorrhages in superior half of the retina involving macula. Previous OCT images showed RNFL thinning in all 6 sectors in right eye and RNFL thinning in all except superinasal sector in the left eye. OCT from the present visit showed no change in the scans of the right eye, whereas the left eye scans showed RNFL thinning in inferotemporal sector with significant edema of RNFL superiorly. Line scan passing through macula showed normal macula in right eye with cystoid macular edema in left eye with subsensory fluid. Discussion. Patients of primary open-angle glaucoma are predisposed to development of vein occlusion. Vein occlusion causes peripapillary edema resulting in thickening of RNFL in the involved segment and may obscure the pre-existing glaucomatous RNFL damage in such patients. A knowledge of previous history and availability of clinical documentation may help in identifying such patients. The follow-up scans are also important in understanding the severity of the pre-existing condition. It is important to assess RNFL image to identify the RNFL swelling and determine the accuracy of RNFL segmentation. If the pre-existing glaucomatous damage is severe, it may be difficult to assess clinically and on imaging for the extent of RNFL loss in such patients. Thank you.